Welcome to another episode of Upper Cervical Chiropractic Clinical Case Review. I'm your host, Dr. Chris Brown, and today we are going to be going in on a really cool case. Widespread joint pain, arm neuropathy, a slew of autonomic systems, a couple autoimmune conditions. And this one was really cool because this is one of those rare stories where this person's symptoms essentially cleared up within an afternoon. And she had been dealing with these for a range of 2 years to about 30 years. So this was a pretty unique case outcome. Let's just say that. So this was a teacher who came to me a couple months into when I first started practice, and her main thing was just chronic pain. She's like, I've been in chronic pain for the past 2 years, and my first neck issue began when 6th grade, and recently at that time she had been told that she needs surgery because of a stenosis or reduced nerve root space at her C5, C6 disc vertebra, essentially. IVF is technically the technical term. But she was having nerve pain, super bad, sharp stabbing, burning neck pain going down the left side of her neck, and also having nerve pain going all the way down her arm, numbness, tingling, burning, stabbing, aching. You name it, she had it. But she also had widespread joint pain, toes, fingers, ankles, knees, elbows, shoulders, like the whole gambit. And with her, she also had a lot of like organ system stuff going on too. She had hypothyroidism. She had Hashimoto's. So she ended up, some of those symptoms for her were heat cold intolerance, malaise, fatigue, weakness. She also had anxiety, depression. She also was dealing with palpitations. She also had shortness of breath, wheezing, asthma. She had the widespread joint pain. She also had headaches and dizziness, which weren't terribly common for her, but sometimes those headaches could turn into migraines. And that was the bulk of what she had going on, which is a lot, right? That's a lot of symptoms. But she was due for surgery. She's like, I don't want surgery. My dad would tell these stories about how he went to an upper cervical chiropractor, didn't really know what they did, but then his symptoms were gone. And so it made her think, like, I need to go find one. And that's how she found out about us. And she had that kind of hope that maybe that would be the outcome for her, and it was. I remember when she got out of the resting chair and I rescanned her, and her post scan looked pretty good, and she's kind of like, I'm starting to kind of feel a little bit better. And then when she came in for her checkup visit and she got down in the resting chair and I was going to pre-rest her for 10 minutes, she just kind of looked at me. She's like, I got to tell you something. And I'm like, what's going on? She goes, I don't feel a thing. And I'm like, whoa, because I hadn't had a widespread joint pain case yet. So that was like, it was almost like fibromyalgia-esque or like rheumatoid arthritis. That was, she was kind of worried about like widespread arthritis being the root of that. And she had seen like all the ologists, rheumatologists, gastroenterologists, cardiologists, all of the ologists she had seen, and they all told her, hey, everything's coming back normal. Your MRIs come back normal. Your CT scans come back normal. Your blood work comes back normal, with the exception of the Hashimoto's, and we don't really know what's going on. You just kind of have to deal with this. She also had ulcerative colitis too. So she had some abdominal pain, like nausea, vomiting stuff, and she would also have just indigestion, essentially irritable bowel. So with her, that was really cool. And she just looked up and she's like, I haven't had a thing since you adjusted me last. And I was like, whoa, that's crazy. So we went through the process for everybody stays the same. It's like when you got chronic health issues, it can manifest as so many different ways because there's access to all of the nerves right in these two bones, and all the nerves create all the experience of life. Like, our bodies are matter and electricity. And the only way that we can experience life through matter, our earth suit, is through electricity. And so the electricity are what creates our experiences. It's also what creates our symptoms and how our organs are functioning and how they are expressing themselves. And so with her, she came in and she told me all this stuff, and she was worried about arthritis and she's worried about surgery and everything. And I was like, well, I mean, I can't make those kind of recommendations and changes. All I know is that your nervous system is involved, and I want to, the next step for this is be able to shoot an x-ray and just see what's going on. She was like, I want to give this a shot. I want to do what I can preventatively before surgery, which is one of the better approaches, is just to go least invasive to most invasive. If the least invasive stuff does not work and you've gone through the gambit of all those, then yes, surgery might be warranted. But if along the way there's something that is not invasive to the body, then that needs to be attempted at least prior to the invasive, not maneuvers, but evasive course of action, essentially. So we took her x-rays and found out that she had pretty bad rotation of this second bone. And this second bone was not rotating from right to left. It was just kind of stuck, and it was hanging out almost like it was like behind her right ear. Like, it was rotated pretty far. And so when that happens, some people that can, it manifests differently for everybody, right? But it was basically torquing her whole brainstem to where all the whole left side was getting compressed, which is why this was essentially super achy and burning and painful, was because it was having really bad constriction of nerve flow and blood flow to the point where her body wasn't really getting it. So that's why she was having that pain. It almost as like she was worked out for the first time, and she was having that nerve pain going down her arm, and it was pretty dramatic for her. She felt like she couldn't really live her life. She was a teacher, she was a mom, she enjoyed being fit and taking care of her body. She enjoyed wearing the shoes that she wanted, and dealing with that arm issue, dealing with the neck issue. She couldn't turn her head to look in the left view mirror to check her blind spot. She had a tough time just moving around, and she really felt like that she had lost a big part of her quality of her life just because of the amount of just widespread pain she was in. I mean, her toes were bugging her, so she couldn't wear the shoes that she wanted to wear. All of her joints irritated her. She was having heart issues, breathing issues. I mean, just a slew of stuff. Anxiousness, depression. She's getting all this news, all this stuff that people don't know what to do with her. Then I come along and run a scan and say, yeah, your nervous system's in a stress state. I know what to do. And she just goes, really? And I'm like, yeah, that's why you're here, right? Is to get that evaluated. And when we have a combination of all those things and nothing has helped, that is the easiest, most predictive thing that the nervous system is involved, because when our body goes through extended periods of time expressing symptoms, and our body is not able to clear it out by itself, and the traditional medicine and care also cannot clear it out, then that is not a structural issue, it's a functional issue. And we need to have a functional test that assesses that. MRIs cannot assess that, CT scans cannot assess that, blood work cannot assess that. The thing that assesses that is a functional nervous system test, which is called computerized infrared thermography. That is what we utilize in our clinic. That's our screening device. That is also what we utilize on every single visit. That's also how we're able to objectively assess progress through care. And it's also how we're able to determine whether or not someone needs an adjustment, because the entire purpose of chiropractic and of upper cervical chiropractic is to restore neurologic function. If someone is functioning, then why would we need an adjustment? But we need to be able to verify that objectively, so that way we know with confidence and we're not just making assumptions in our own human brain. So this is our checks and balances, is that scanner. It looks like a Walmart scanner. You run out the back of the neck, and on exams we also do the entire spine, because our goal is not just to restore function of the neck. Our goal is to restore function of the entire spinal cord from C1 to S1, and we know that the only avenue to doing that through our studies of physiology and neuroanatomy are via the first and the second bone of the neck right here. So with her, we found out that the second bone of the neck was her culprit. We administered a correction of that second bone from a rotational piece unique to her. The adjustment is by hand. There's no rotation of the head or neck, which she appreciated because she just got told recently that she was due for surgery. So she was like, I don't want to get the rotation, twisting of my neck. I don't want that. And I'm like, perfect, because we don't do that. With her, it doesn't happen with everybody, but with her, she saw a dramatic change out of the gate. Most people, it's more of a gradual change because nerves take a long time to heal, but for her, like toes, ankles, feet, hips, fingers, elbows, all the joint pain she was having was cleared up pretty much like within that day. The neck pain cleared up, the nerve issues that she was having cleared up, eventually the palpitations, shortness of breath, thyroid issues cleared up, and on her first re-exam, just 6 weeks in, she is like, I feel like I got my life back. That's what she wrote. She said, I feel like I got my life back. I can move again. I can wear the shoes that I want. I feel like I'm able to live. And that is one of the biggest parts of what we're providing here. We're not providing nervous system care. We're not providing chiropractic. We're providing hope. And we're providing hope towards the people who have been told that everything comes back normal, that there's nothing we can do, that you're going to have to deal with this for the rest of your life, that it's been all in your head. And we're the ones that, for some reason, end up being people's last resorts. And it's because they just don't know about it and they haven't heard about it. And it's rare. And it's rare because it's really difficult to do well as a doctor. It's really difficult to execute well. It's really difficult to understand all the science behind it. I mean, brainstem neurophysiology is not easy. It is not easy at all. Trying to reason in your head, how can two bones be that important for the entire human body is tough to reason in your head. Trying to read these scans and understand and actually have to determine, do I adjust or do I not adjust? That's very hard. Having to analyze x-rays where you're just looking at one or two bones and you're like, hey, this one decision will have a dramatic impact on this person's life and well-being, whether it's good or bad. And I cannot mess this up. This person is paying me to not mess this up. And there's 276 different combinations of these two bones. And we are tasked with figuring out what is that one for this person. Every single time, day in and day out. And 90% of people have a misalignment of the top bone of the neck. 90% of people have a malfunctioning nervous system and they don't even know it. They have this underlying issue that's going on. They have no clue and they're just living life in darkness. Instead, in light like this. And the world just needs to know about it. So, that's why we're here. That's why we're doing these videos, to just share the stuff that I'm seeing in clinic. Dr. Grant has probably seen over 1,000 people. Dr. Cam is close to, 150, probably 200 people that he's at least managed. I'm approaching 75 people that I've managed. All different cases, different stories, different backgrounds. But it just goes back to this one principle where if the nervous system is involved, there's a chance that that is the source of your symptoms. And we know when the nervous system is in a good place, good things can happen because it controls everything that's being expressed in our body. So I went off on a little tangent there. I went off on a little rant. This person, she's awesome. She ended up being one of my favorite patients to take care of. And she trusted care. She trusted the process. There's times where she came in. She still had symptoms every once in a while. We can't expect symptoms to be one and done and just gone forever. That's not the case. That's not what we're doing here. We are taking care of function, not symptoms. If I kick my toe against the door, it's going to hurt. Does that mean that my nervous system is in a bad place? No. So therefore, symptoms don't necessarily dictate function or lack of function. Function does not necessarily dictate symptoms or lack of symptoms. Function dictates function. And sometimes our body does need to express symptoms to let us know that there is something going on that needs to be addressed. Sometimes it does correlate, sometimes it doesn't correlate. And those visits happen. And those, yes, those are tough visits for us, but in the long run, we want to make sure that we're functioning well, because if I adjust on a day where someone is functioning well, then my hand is no different than a car accident, which is why it is incredibly imperative to have that nervous system test, because there's been plenty of times in practice where I have ran a scan, it looks absolutely phenomenal, and the person is symptomatic. That means that the body is just working through it. The body is being exposed to stressors, but it is in a place to handle that stress and be able to work itself out on its own, which is way more powerful than anything that I could possibly do with my hand. It's as simple as that. Everybody needs to be checked. Not everybody needs to be adjusted. I have evidence of that in this clinic. I've had evidence of that on service trips. Not everybody needs to be adjusted, but everybody does deserve to get checked. So if you have an opportunity and potential local access to an upper cervical chiropractor that does these scans that are called computerized infrared thermography, please go ahead and do yourself a favor and give that clinic a call for either yourself or your family member of your friend, because it is the best thing that you could do for your health and vitality and longevity. So that's what I got for you guys today. Thank you. My name is Dr. Chris Brown. Thank you for tuning in.